Tonight, Maine's Department of Health and Human Services says it is making changes. The department faced intense scrutiny this year after 5 children died in the span of just a few weeks.
Now, after an independent report flagged concerns, DHHS says it has a clear plan for improvement. These are the details.
229, go ahead.
Step number 1. Work with hospitals and law enforcement to make sure hospital staff share enough information about a child with officers in a timely manner. Doing so can help officers communicate to child welfare staff the info they need to make sure the kid stays safe. The department plans to have a roadmap and training by January. Number 2, developing guidelines for clinicians like doctors or therapists who help patients struggling with mental health or substance use disorders. The report found healthcare workers helping parents with these issues were less likely to coordinate with child welfare staff. The goal is to improve information sharing and have the guidelines done by winter. Number 3, clarifying guidelines on how to hold family meetings to best support child safety. The report said child welfare staff needed consistent practices and more clarity on what their roles are. The department plans to finalize that policy by November of this year. Number 4, taking a hard look at the standby and after-hours staffing. The department says it changed these practices in October. Specifically, they added more staff on weekends and holidays, adjusted the length of shifts, clarified expectations for workers, and better defined the roles for those working these shifts. Leaders plan to revisit this work group in January with the help of Casey Family Programs. And number 5, developing a parent mentor program. The department wants to engage with parents more. One area the report says DHHS fell short. Leaders will add more parents with lived experience in child welfare to the training teams by January.
Now, Todd Landry, the director of the DHHS Office of Child and Family Services, said in a statement, "There is no higher priority than keeping Maine children safe." He wrote, "Our child welfare staff are devoted to this responsibility, and we continue to do all we can to support them in their critical work." We also reached out to Senator Bill Diamond, who's been fighting to overhaul the child welfare system and separate the Office of Child and Family Services from DHHS. He said the initial report did not meet his expectations and that he hoped for more quantifiable action items. He feels the child welfare system is in dire straits.
You know, did it take these deaths to do these common sense sort of things? That's what bothers me. I think the attitude is still that we're going to improve on a pretty good system, when in fact, it takes a lot more of improvements on a good system. The system is broken.